As mentioned during a press conference, the Sacramento Sheriff's Office announced that they will no longer be responding to all mental health crisis calls. Sheriff Jim Cooper is saying that he doesn't understand if a crime isn't committed, why his deputies should respond to the call.
We can't keep doing what we're doing and coming to these calls. It has to change. And as sheriff, I have the power to make the decision, and we're going to change how we do business.
The protocol has changed for mental health calls made to 911. Now the dispatcher will ask questions to determine if a crime is being committed. The communications supervisor will then decide whether to deploy deputies to the scene.
And if it is dispatch, the watch commander, a sheriff's manager, lieutenant, will be vetted, the call will be vetted to ensure there are elements of a crime or someone other than the mental health subject is in danger.
Sacramento County Sheriff Jim Cooper stated that the policy change aims to protect the community and prevent his office and deputies from facing lawsuits. This decision follows the Ninth Circuit Court of Appeals ruling, which determined that law enforcement officers no longer have legal protection when responding to a call where no crime is being committed.
And that's a big issue. There have been bad outcomes in California and throughout our nation where folks have reached out and called law enforcement and someone dies as a result of that. I don't want that happening.
Due to changes in policy procedures, fire agencies are now responsible for responding to mental health crisis calls independently. We spoke with Metro Fire, which is now handling these calls without the involvement of the Sacramento Sheriff's Office. They tell us their team has received minimal training and in some cases lacks the protective gear necessary to ensure firefighter safety.
We are literally walking in and we are sitting ducks for anybody that potentially could be on the other side of that door that wants to do some serious damage. It's only a matter of time before one of our members is either seriously hurt or gravely injured as a result of this decision.
Metro Fire has stated that their operation and response to calls has changed with the new policy that has been in effect for a couple of weeks.
Just in the last week alone, we've taken box knives and weapons off of people. That's normally not our job. We've had to respond to somebody that was breaking glass and threatening the folks inside that home. Threatening with suicide. It's been a really challenging week for our crews to really be operators in the field.
David Bain, Executive Director of the National Alliance on Mental Illness in Sacramento, states that they disagree with these changes to policies, which they say will negatively affect families and individuals struggling with mental health.
And so now that 911 is telling people to call 988. Well, 988 is not sufficiently staffed to do this, to handle this issue at this point in time. So calls are being left, calls in for help are being left unserved.
Sheriff Jim Cooper highlighted the county's underutilization of 988 in hopes to encourage more people to use it, as the service is better trained to handle mental health crisis calls. Sheriff Cooper mentioned that if someone is threatening to harm themselves or others, they would respond to the call.
Let me say this first and foremost. It is not a crime to be mentally ill. A lot of folks suffer from that. Some folks get the help they need, some folks don't.
To clarify, any mental health related calls that the Sacramento Sheriff's Office does not respond to will be transferred to 988. Both the Sacramento Sheriff's Office and Metro Fire say that they need additional support to respond to those mental health crisis calls. In Sacramento, covering local news that matters, Christina Bautista, Fox 40 News.